Today I'm going to be showing you some of the correct methods of brushing your teeth. When we brush our teeth, we remove the plaque and debris from our teeth. Many people think it's the toothpaste that cleans your teeth, but it's actually mostly the bristles that do the cleaning. So it's really important that we brush correctly. When we clean our teeth correctly, harmful bacteria in the plaque are removed, and so we are less likely to develop cavities and periodontal disease. It is important that you choose the method that suits you. However, if you have difficulty with one method, you can try other methods as they all assist in removing plaque and debris. The first method I'll be showing you today is the Barse method, which is recommended for people without gingival recession. We begin by placing the toothbrush 45 degrees to the gum line, like so, and begin small vibratory movements like so, and after about 10 strokes we move on to the next tooth surface, making sure to overlap the last set of strokes. After we have gotten all these surfaces here, we move on to the inside surfaces, doing the exact same technique. When we get to the central teeth of the upper and lower teeth, we do a heel to toe motion like so. After these strokes have been completed, we move on to the chewing surfaces, which are the surfaces right here and right here. So we do a horizontal movement, a horizontal back and forth stroke on these surfaces, and we have done the Barse method. The next method is a modified version of the Barse method, which includes a rolling motion at the end of the vibratory movement. We begin in the same way by placing the toothbrush 45 degrees to the gum line and doing the 10 vibratory movements and rolling the toothbrush away after the 10 strokes. After the rolling movement, we move on to the next tooth. 10 vibratory movements and roll. 10 vibratory movements and roll. And we do the same for the inside. But with the central teeth, we still do the heel to toe movement. And after these strokes have been completed, we do the horizontal back and forth movement on the chewing surfaces of the upper and lower teeth. The last method I'll be showing you today is the single tufted method, which is ideal for cleaning around implants, braces, crowns and bridges, as well as difficult to reach areas such as wisdom teeth. We begin by placing the brush onto the tooth surface, like so, making sure to splay the bristles and doing small wiggle movements, like so, at a medium pace. If you have braces or implants or any sort of restoration work, make sure to get underneath the areas that are difficult to reach with the single tufted brush before moving on to the next tooth. To get the inside of the tooth, we have a modified version of the single tufted brush, like so, and we can reach like so. Remember, with all these techniques, focus on removing the plaque near the gum line and your back teeth. People will often miss these areas. The amount of time that you will need to spend brushing your teeth depends on how much plaque you have on your teeth. Generally, you will need to spend about 2 minutes twice per day, but you may have more plaque present due to, for example, cavities or restorations, and so you will need to brush for longer. Also remember to replace your toothbrush every 3 months or when the bristles become frayed, as well as to see your dentist every 6 months for a checkup and professional cleaning.